welcome to the YouTube channel. Today we're going to talk about complications of diabetes. Diabetes is a disease where there is excessive sugar, and we did a part 1 of this video where we spoke about how diabetes is diagnosed and what is the pathology or the cause behind it. Today we are going to discuss a little bit about what are the complications that people will develop if they don't control their diabetes. So the major complications actually with diabetes affects because of the high sugar. People who have high sugar will generally not experience any symptoms in the initial phases. Because of that, it's really important that you see your GP and get the blood sugars monitored. You can also use a finger prick blood sugar machine that you can buy from the pharmacy, and usually when you're on NDSS or if you're registered with the Diabetic Society, you will get this blood sugar machine funded through them. The common complications are, it will affect generally any organ in the body, but mostly the eyes. With the eyes, people will develop cataract and also what we call as diabetic retinopathy. These sort of pathologies basically cause the back of the eye to inflame and cause deposits around the back of the eye, which then will affect the vision. Cataract is a pathology where this affects the lens of the eye, and that also can cause vision problems. Getting your eyes checked once a year is a very important thing, because if you can get this checked and if you can find any changes and pick up this early on, it can be treated very fast. The second issue is a diabetic foot or foot problems. Diabetic foot problems are serious and can also lead to amputations. Nerve damage to the foot can cause reduced sensation in the toes and on the feet. What this will do is, in case you have a cut on the feet, on the sole of the foot especially, people will not notice it until it's really bad, and this will then cause infection that will spread through the bones. Some people may end up having amputations because of that. Diabetes causes problems with the heart and also can cause risk of stroke. So it is very important that is managed with managing the sugar as well as your blood pressure. The other problem that can be affecting your body is your kidneys. Kidneys are the organs that filter your urine, and often what happens is, due to high sugar, the kidney membranes get damaged. We call this diabetic nephropathy. And in worst case situations, you will sometimes end up with kidney failure and end up needing dialysis, as well as sometimes in some instances needing kidney transplant. The other problem I mentioned earlier about foot problems, which caused by nerve damage. So nerve damage can happen throughout the body. It's not just only on the feet. It can also affect areas like your hands, your legs. It will reduce your sensation. There is also a condition called autonomic neuropathy, where it can affect the process of your gut. Some people experience bloating, some people experience reflux, digestive issues because of this. And one of the most important things that diabetics need to remember is, with autonomic neuropathy, this is often seen in type 1 diabetics. Now, what causes the complications associated with diabetes? High blood sugar in your blood over a long period of time can seriously damage your blood vessels. If your blood vessels aren't working properly, blood can't travel to other parts of the body. This means your nerves won't work properly and also lose feeling of the body parts. We know that the higher the HbA1c number, that is the amount of sugar control over the last 3 months, the HbA1c number, the higher it is, that means it's poorly controlled diabetes. So it's really important that when you're having your 3-monthly blood check, you check your HbA1c number. It's also really important that you check your kidney function, do a urine test to check whether there's any protein leakage from the kidneys. Make sure you check your blood count, your cholesterol levels, have an annual eye checkup, have an annual foot check. These will all be important. Remember to always check your blood pressure, and every 3 months go and see your doctor and make sure you're keeping up with your medications. So this was a quick update about the complications of diabetes and how you can keep up on top of these things to prevent developing complications and to have your diabetes well controlled. This is Dr. Chamira here, one of the GPs from the Doctor's Werribee. If you like our channel, subscribe, hit the like button, and if you have any questions, put it in the comments section. Hope to see you next time with another help.